Youth Services is the place to turn to for mental health services for children and adolescents in Chicago's northern suburbs.
Joining us now with more is Executive Director Amy O'Leary. Thank you so much for being here.
Thank you so much for having me.
Such an important conversation that I think might get overlooked a little bit because so many people are struggling with mental health right now, but kids really had to go through it during the pandemic.
Yeah, absolutely. And to be honest, I think even prior to the pandemic, we were seeing an uptick in mental health referrals. Fast forward, 2 years happen, and referrals have just increased exponentially. So in some ways, the COVID-19 pandemic has really created a mental health pandemic. I was reading something just the other day that I think emergency room visits alone have increased by over 30% for kids who have mental health related issues. So the good news is that there's organizations like Youth Services who are around to provide that support.
And when we talk about children, we kind of just group them all together, but depending on the age of the child or the adolescent, I mean, there's a range of issues that, each grouping would face.
Yeah, absolutely. Right now, our youngest client is 5, our oldest is 21. So there's definitely a broad range, and, we are an organization that's definitely not trying to be everything to everybody. We want to specialize in what we do well and refer out when the need falls outside of the agency scope. So the kids that we see are typically struggling with depression, anxiety, familial stressors, academic pressure. So there's a broad range of issues that kids are ultimately struggling with.
And how do you determine when a kid is struggling versus just dealing with growing up? Because I come from the generation where you're like, rub some dirt in it, you're okay.
Right.
But we can't do that, and I know that we can't do that. So what do I look for?
I think you just look for, I always tell parents, you know your child better than anybody, and if you feel like their functioning is really starting to be affected, then it's probably time to get some expert opinion.
Okay. And often getting treatment for mental health is always a socioeconomic issue.
Yeah, right.
I mean, a lot of insurance doesn't cover it. A lot of people don't have insurance, but you see kids for free?
So we really pride ourselves at our agency by never turning anybody away based on ability to pay. So we have one of the most generous sliding scales in the northern suburbs. We like families to pay something because there's a buy-in and it places a value on the services that we provide, and they take it more seriously. But probably about 50% of our clients utilize our sliding scale. On the flip side, we also are paneled with multiple insurance companies. So we do have families that have health insurance who can utilize that to pay for services as well.
What can we do as adults and just really the general public to help you guys help our youth?
Yeah, I think raising awareness, I think for us in particular, there is oftentimes a misconception that there's no need in the northern suburbs of Chicago. And what we see on a daily basis, that is definitely not the case. Our clinicians know that mental illness, poverty, familial stressors, those things do not discriminate. And we're doing our absolute best. And unfortunately, the need is higher than ever because of the global pandemic. But
I'm sure social media too.
Yeah, coupled with social media, technology, political unrest. I mean, there's a lot going on that, it's just a much more complicated world to grow up in compared to when we were in school.
Yeah.
I mean, you're doing incredible work. Just give us an idea of just how many, young children to young adults that you guys are seeing.
Yeah, so annually we see about 1,500 individuals, and we serve them through a variety of ways. We do individual and group therapy. We have a lot of after-school programs that target specific under-resourced communities in the northern suburbs, and we have a really large Pride program that serves a growing number of LGBTQ+ youth. In regards to how we see them, we have an alternative treatment model. We really like to use activities to connect with kids therapeutically. We use art, music, play therapy, and our facility is especially conducive to that. We have a full-size gym, a variety of different therapy spaces, and we feel like that puts our clients at ease. Over time, we can develop a rapport and have those clinically relevant conversations.
And I would imagine for a kid being in a setting where they're around other kids similar to them, struggling the same struggles they're struggling with, is probably in itself therapeutic.
Yeah, absolutely. It normalizes what they're going through and validates, those types of feelings that they're having, which is why our group programming is so important as well.
And it makes parents feel better too, I'm sure.
Oh yeah, just knowing that you guys are out there. Thank you so much. We really appreciate it.
You're welcome. Thanks for having me. me.
We'll make sure we get all the information for them on the screen. Youth Services on Lake Avenue in Glenview. I see the website there as well. Amy, we appreciate it.
Thank you.